This video summarizes very briefly the treatment options available for cranial cruciate ligament disease in dogs. Management of this condition is complicated and controversial, and all aspects need to be considered. The signalment of the dog, especially the size and the breed, the home environment, the financial constraints, if any, the physical ability of the client, and the time that the client has available. Surgery is most often chosen to treat cranial cruciate ligament disease in dogs. The first surgical option is intracapsular grafting. This technique has become less popular than it was 2 decades ago, perhaps because the grafts undergo degeneration and often fail. Extracapsular stabilization is most commonly performed. Either a lateral fibular suture can be placed, or the tightrope procedure, which also falls into this category. The goal of this surgery is to passively stabilize the joint by neutralizing cranial draw and by stimulating periarticular fibrosis. Prolotherapy is another technique which encourages fibrosis. And with regards to surgery, numerous intra- and extra-articular procedures that attempt to mimic the restraint normally provided by an intact cranial cruciate ligament have been reported. No technique, however, satisfactorily stabilizes the femorotibial joint or prevents progressive osteoarthritis. The procedures do not attempt to address cranial tibial thrust, and so each one of those previously mentioned is likely to result in osteoarthritis. Corrective osteotomies are another category of surgeries which can be performed. The aim of these procedures is to eliminate abnormal cranial tibial thrust and weight bearing by altering the joint biomechanics. Although these procedures may result in faster recovery, the final outcome is not better than classic cranial cruciate ligament surgical techniques. Popular at the moment is regenerative medicine. This is presented in the form of platelet-rich plasma therapy, stem cell therapy, or a combination of PRP and stem cell therapy. Preliminary results look favorable for dogs with a partial cranial cruciate ligament tear. Many people are considering conservative therapy and may make use of a custom stifle brace in the event that they choose this option. The basic tenets of conservative management are not negotiable. Number 1, no running, no jumping, and no playing. Number 2, manage the dog in a harness and on a leash for at least 3 months. Number 3, ensure confinement when there is no supervision. And even with the best management, this is a long road to recovery, but the dogs can and do recover. And a final word on cranial cruciate ligament disease in dogs. Physical rehabilitation may be at least as important as surgical technique in affecting functional outcome. In other words, whatever you choose to do and however you choose to treat these dogs, physical rehabilitation should be absolutely imperative and non-negotiable.